Welcome to another episode of the Pondering Parenthood podcast, Triple P.
Triple P.
I am your host, Mike, here with my co-host,
Megan.
We've been doing this for close to a year now.
Yes.
Coming up on our 1 year anniversary here soon.
We will be ending season 1 very soon.
Ending season 1. We're going to take a very short hiatus. About a month, right?
Yeah.
And then we're going to be back. But we're not here to talk about that today. Here to talk about this episode of Triple P. Today we have Jay Phillips. She is a
dear friend,
mother of 2 lovely children.
Mm-hmm. In this episode, she will refer to them as Peanut and Jelly as their nicknames.
Excellent. And yeah, we cover a wide variety of things in this episode. Tell the guests what we talk about in this episode.
We talk about their journey into parenthood, she and her husband. We also talk a little bit about her experience with dysphoric milk ejection reflex, or D-MER. And that was really fascinating.
First time I'd ever heard of that.
Yeah.
I'd never heard of that before.
I had heard of it, but this is the first person I know who has had it. So that was really interesting. And
so yeah, a lot here for everybody. And as we said, this will be our last interview for season 1. We'll do one more episode of just the 2 of us.
Do a little season 1 recap.
Season 1 recap. And then we'll take a month off.
And just to note, I am joining in on this interview, so there will be no recap at the end of this episode.
Yes.
Since I'll be there.
So for those of you who come here for
listen to me,
the interplay between myself and my lovely host, co-host, and wife, this is all you get. This is it, because then the rest is all with the guest.
That's true.
Yeah. So just I guess skip this one and go to the next one, I suppose. No, don't skip this one. This is a good one.
We hope you enjoy this show.
We are here to interview one of our good friends, Jay Phillips. How you doing?
Good.
Yeah. So
Excited to have you.
And also, unlike most of our episodes, we're actually all together.
We're in person.
We're not doing any Zoom or Google Meet or anything like that, or phone calls. We're all here.
That's right.
Which is very exciting. Yeah. So I've forgotten what this podcast is about.
This is the Pondering Parenthood podcast.
Oh, right. We talk about parenting here.
Yeah. Triple P.
Cool. All right. So let's just jump right in, yeah?
Yeah.
All right. So our first question, Jay, we like to ask a lot of our guests is, was becoming a parent always part of the plan? Is that something you had always wanted? Or kind of what is your journey, not just in parenthood, but to parenthood?
Yeah, so I think when I was really little, I'm not really sure if I thought much about it, but once I was a teenager, I think I definitely knew I wanted kids. Because I'm one of 5, and so I always loved having siblings. And so I was always like, oh, I'm going to have 5 kids. I'm going to have all these kids, and it's going to be just like I had, and it's going to be so great. And then I met Zach, and this is going to make me sound insane. The first time we were really hanging out, he was like, I've always wanted 5 kids. And I'm like, me too. And then that was just basically our plan from then on. When we were 17. And we were like, yeah.
Yeah, it's crazy to be 17 and decide that you want 5 kids. I'm sorry, that's a hot take.
We weren't even dating.
Yeah, right. It's like to be 17 and be like, I would like to have children at some point makes total sense. To be 17 and go, yeah, I think I want 5 of them.
Yeah.
This is a take, for sure.
So his dad is one of 5.
Right.
And so he was like, well, I also want 5 kids. And we're like, good. This is a great plan. Mm-hmm. Let's just go in that direction.
Sure, yeah.
And,
we were the opposite. I was done after 1. We had talked about having more than that, and I was after 1, I was like, no way. Are we ever having another kid?
Once we had the one.
Yeah, once we had the one. Yeah.
Well, I mean, now after the first was born, I think that was still, I was like, yeah, this is going to be fine. We can keep doing this. And then the second was born, and I was like, I don't know about that.
I don't know about 5.
Yeah.
Okay,
Yeah.
so not only did you know you always wanted to be a parent and have kids, but you knew you wanted to have a big family.
Yeah.
Yeah, cool.
Mm-hmm. And it's hard because it's now that a variety of reasons. I'm like, I don't know if maybe one more. Definitely not past that.
Right.
It's like, oh, but I always pictured like this big gaggle of kids that are all like best friends and stuff, and now it's like, what is it if it's not that? Like, it just is such a different vision.
Yeah.
And like, one of the things that I think we've talked about before, Megan, like the idea that you can create a community for them without physically producing it for them. You can, like, I don't know, make friends.
Right.
Have kids.
They don't have to be blood related.
Yeah. And that makes it easier to, like, I think, be a more active and involved parent if there's only 2 of them, instead of like trying to divide everything up among 5.
Yeah.
But then they can still have that relationship with other people.
Right.
Yeah.
I don't want to get into it now because I think we'll kind of uncover, but it'll be interesting to talk about sort of what has led to the change in that, and because I'm sure that there's some grief and mourning around that. And so your husband Zach also was interested in having 5, and he was totally on board on it right away. Wow, this I mean, good for you guys for finding each other. Like, that's pretty impressive.
Yeah. And we were 17, and with less than a year later, we're like, okay, we're gonna get married. We were like fully on board.
That's great.
Yeah, actually, Megan was the first person to find that out.
Yes.
After him and I talked about it.
I was their RA.
Oh, I remember the story.
Well, I was Zach's RA,
Yeah.
and I was going through a breakup, and Zach shows up at my door, and he's
very aware of how other people are feeling.
Yeah, with Jay
Classic.
on Google Meet or whatever it was, Skype.
Yeah.
And he's like, "We just decided we're gonna be together forever." I'm just like, "Cool, bro."
I think we'd met maybe once at that point, and I was just like,
It was very, very Zach.
Very
Zach, yeah. Okay, so, at some point, you're no longer 17 and thinking about 5 kids. You and Zach decide we're going to actually do it. Can you just kind of give us the highlights as to, like, things that you think other people might want to hear about regarding getting pregnant? If Zach were here, he would give all of the details like he does in his Christmas letters. But, but we're not looking for that. We're looking for sort of, like, high level, like, getting pregnant, the pregnancy and then birth.
Mm-hmm. Yeah, so we ended up getting married at 21, and we're like, we're still young. We just, have a good time and hang out and not try to start any of that yet. And so, but we were like, if we want 5 kids, we can't wait too long. Because even if we were, like, real efficient about it, and it was, like, every 2 years, that's still, like, 10 years. And so, thinking back now,
it's just...
I had no idea what I was getting into.
Yeah.
And so it was like mid-20s. We were like, okay, like we have to start thinking about this. And we had kind of settled on like maybe mid-2020. And that was like in 2019, I know. And so then 2020 comes around and COVID hits and we're like, no, not right now.
Yeah.
And so
we did not make that decision.
Yeah.
Went for it.
And so we're like, okay, let's wait till this is over. And then we heard about the vaccine and how effective it was. And we're like, okay, we're going to wait till the vaccine comes out and we can get it. And then that's going to be like the point. And so that was kind of weird because it was like trying to get it as early as possible, but knowing like, well, if I get it this month versus this month, it might be like 2 totally different tracks. But we ended up getting the vaccine. And so we were in the Pennsylvania suburbs outside Philly. And so it was like a relatively liberal area, but it was right on the edge of where it turned into like rural conservative area.
Right.
It's like we could not get the vaccine near us, but if you drove an hour and a half, you could because no one out there wanted it, and so we could just drive out there.
Right. You mean an hour and a half into the rural area?
Yeah. Out of the city. Yeah.
I was thinking like you meant like an hour and a half towards Philadelphia. I was like, the other way.
Yeah, and so we both drove to York, and went and got vaccines in the middle of nowhere. And then it was just right after that. I think we waited for the 2 weeks for it to go into effect after the second dose, and then just started trying to get pregnant after that.
Very thorough.
I mean, we're both scientists.
Yeah.
We're gonna be really on top of it.
This is like you guys are describing the two of you to like this is like a perfect example of like explain these people to us. This is it.
Yeah. Yeah. I mean, the whole time, like I worked at a pharmaceutical company during COVID, and so like we're getting like up to date information on vaccine trials at work, and so like we were very on top of it. Which is I think part of why we wanted to wait too, because it's like I saw all the data all the time of like the effects of getting COVID in pregnancy, and I was like, that sounds really scary. It's like, pregnancy is scary enough as it is.
Yeah.
And then it was pretty quick. So it was 2 months. Zach was like, we're waiting till the 30-day mark. He's like, we're not going to test earlier. We don't want to, like, set ourselves up to be upset. And so we're going to wait till the 30-day mark. And we were in Wisconsin visiting his family, and we were going to go camping. And so 30 days was going to be while we were in the middle of nowhere at a campground, no cell service, no grocery stores, no anything. And so I was like, I'm going to buy a pregnancy test. I'm like, I'm not waiting till after.
Yeah.
We're going to get one. But we were staying with his parents and didn't have a car. And so I was like, I need to find an excuse to go to the grocery store. But not just, like, I have to go by myself.
Yeah.
And so we needed something, and I was like, oh, I'll go do it. Like, let me. And they're like, no, like, we can do it. I was like, no, please. Let me go. And so it was just like this little, like, rinky-dink grocery store in the middle of nowhere in Wisconsin, and they had one pregnancy test.
Oh, wow.
Like, one, not one version, but like one brand.
Yeah.
It was like $3. I was like, is this gonna work? And it did. And, but we were at the campground, and so it was like, I think it was in the morning, and so we're like, oh, we're gonna go brush our teeth at the bathroom over there. And so I went and, like, peed on the stick, and then, like, capped it and, like, wrapped it in toilet paper so I could bring it out and we could look at it together. And I had, like, a timer on my phone, because you have to time it right.
Oh, you do?
Yeah. And I just, like, we take it off, and it's, like, the 2 lines or whatever, and I'm just like, and Zach is just like immediately like, oh my gosh, I'm just like, what did we just do?
Oh man.
Yeah. And not in a bad way, just in a, like, it is all
Now it's
different
real.
now.
Yeah.
Yeah. And it, like, I couldn't process it. I was just like, oh my gosh, what is this? And so I was like, I don't want to tell everyone right away. I'm like, I want a day for it to be just us.
Yeah.
And then Zach's like, okay, well, then we have to tell my parents the next day. And his brother was there too. And I was like, okay, like, they're your family. You can take the lead. We can tell them how you want. He's like, oh, I want to make it, like, a big surprise where everyone's like, what? I was like, great. I really love attention. So I was like, wonderful. And so we were eating dinner, I think. And he was like, oh, it's so great to be out visiting you guys. You'll have to come out and visit us in the spring to meet the baby.
Aww.
I remember looking at his mom, and it was like, huge eyes, mouth open, like, frozen, like, just like, oh, everybody's looking at me.
Oh, that's
so they were
awesome.
excited.
That's so great. I love that story.
Yeah, everyone was staring at me. But it was good.
So we forgot to say earlier, how many kids do you have, and how old are they now?
Yeah, so 2 right now. So Peanut is 3.5, or almost 4, probably will be by the time this airs. And Jelly is 1.5 years.
Yeah, so that
A little girl.
she's using nicknames like us
Yeah.
for this episode.
Peanut and Jelly.
Peanut and Jelly, I love that.
Peanut. We actually call Peanut. Hence the theme.
So we've talked about some highlights, like, leading up to pregnancy. What are maybe just, like, a couple of major highlights, maybe some anecdotes or stories from actually being pregnant?
Yeah. So in general, everything went smoothly. It was, like, a very healthy pregnancy and everything. But I remember I went for my first blood work. I think they do it 8 weeks. And I get a call from the nurse. It's like a Friday afternoon. She's like, hey, you just got your blood results back. We just want to let you know your syphilis test was positive, but don't worry. It's very, very common to get a false positive in pregnancy. It's just a Friday afternoon. I didn't want you to see that and then freak out and not be able to get a hold of anyone. It's like, great. And a couple hours later, she calls me back. She's like, so the secondary test we do, the confirmation test, was also positive, and so we're going to go ahead for treating you for syphilis. It's like, stop. I don't have syphilis.
Right, this is you've been with just Zach, the person who decided you both were going to have 5 kids. Like, yeah. Like, from 17 on.
Yeah, there's nothing else going on. And I was like, I don't have syphilis. And where we were living, you have to go to this, like, outsourced place to get blood work. I was like, they probably mixed up me with somebody else. Like, let's just redo it. Mm-hmm. And they're like, oh, yeah, we can redo it. So I went and got it done, and it was negative. And they're like, well, because it was positive originally, we still want to treat you for syphilis. I was like,
Wow.
guys, I don't know how else to tell you. I don't have syphilis.
Right.
And so they're like, okay, you have to go to the maternal fetal medicine people, and they're gonna deal with this. And they involved the health department too.
Oh my god.
Like, I can't even remember how the order that all this happened in.
This is wild.
But I had like multiple calls with the Pennsylvania health department.
What?
They're like, you need to get treated. I'm like,
I don't
have syphilis.
Oh man.
And so they're like, but I remember the nurse was like, the secondary test doesn't have false positives. And the scientist in me was like, well, that's not true. Because no test has no false positives. That is just not how
That's not how experiments work.
It's not how experiments work. And at the time, I was working at a pharmaceutical company in a lab doing science. And so all the medical research basically is behind a paywall. But if you work at a company like that, they pay for these things. And so you have full access to all the medical research. So I was like, I'm going to get to the bottom of this. And so I figured out what test they did and looked into it, and it turns out there are false positives in this test.
Surprise, surprise.
Surprise, surprise. And one of the leading things that can cause a false positive is pregnancy. And then the other thing is autoimmune diseases, which at the time I had eczema, and I wasn't able to treat it with the medicine I normally use, and so it was very out of control. And since all of this, many years down the line, I've been diagnosed with Crohn's disease, so there's probably also that going on. And so that explains the false positive. But they still were like, yeah, we don't know, like, you really should get treated. And
well, just when they did the second test, I assume that they do a primary and then a secondary on that as well, right?
So that was like the secondary test. So the primary one is like the quick screening test.
Right.
And then the secondary was like confirming only the people that come back positive.
Right. So if you come negative, they don't even do the secondary.
Right.
Oh, I was gonna say, because like, wouldn't that not have any false positives or false?
Right,
I guess yeah.
Yeah.
Yeah, interesting.
But they're still like, you need to take this treatment. I was like, I really don't want to.
It's also up to you. 3
massive doses of antibiotics. I'm like, I don't have syphilis. I don't want to take this so I don't have syphilis. And so
I love how much you're able to advocate for yourself with your scientific background, though.
Yeah,
like,
it was just so ridiculous.
I would just be like, okay, you're the doctor,
Yeah.
like, you're telling me what to do, I'm just gonna do it.
That's partially Zach, too, because he's like, you don't have syphilis. I'm like, I know. But they're like, okay, so there's 2 ways you can get it. Like, obviously, it's an STD. You can get it through that route. Or you can get it from your mom in the womb. And I was like, I don't really want to go down that road. But I was like, so we had Zach tested just to convince them that there wasn't any kind of shenanigans going on.
Right.
But I was like, well, I don't really want to ask my mom about this, but I have a twin sister. She was there at the same time.
Yeah.
And so, and it's funny because she's a doctor. She's an OBGYN. And so I called her. I was like, I need you to go get tested for syphilis.
That must have been a fun conversation.
Oh, it was, she was fun. She was like, because I explained the whole thing to her, and she's like,
okay,
that makes sense.
I'm on it.
And hers came back negative. And so between me saying, like, I'm not doing anything bad, Zach's test being negative, and Sarah's test being negative, we were able to convince them that I do not have syphilis.
I guess, like, what is the, because, like, you know, and especially with Zach testing, right? And, like, obviously there was no concern there, but he tests, that's negative. It's like, you don't have it. Obviously, like, don't they just have to drop it? Like, what would they do? Would they just not, like, care for you while you're pregnant?
I mean, they would accept, if I said no, they would accept it.
Right.
And they would track the growth. So it's
right.
like, if you do have syphilis, it can restrict growth, and that's what they would have looked for.
Right.
They still did make me go back for an extra ultrasound at 32 weeks to make sure that the baby was growing appropriately. But yeah, I was able to convince them that I did not have syphilis. But there is...
Well done, Jay.
Okay.
Congratulations.
Thank you. Yeah,
You did it.
Yeah. Well, it's funny, though, because I saw multiple doctors in the practice, because there were 7 of them. And one of them came in one day and was like, oh, you're the syphilis girl. I was like, not really how I want to be referred to. Thanks.
Oh, man, that's rough.
Yeah. The point of this will come up more later with some of the stuff after the delivery. But right from the beginning, like 6 weeks in, 6 weeks into the pregnancy, I was like, sex hurts. And it was like, in a very weirdly specific way. Like, one specific spot, and I was like, is there something wrong with my cervix? Like, is this a problem with the pregnancy? Like, as a scientist, I know enough about things to freak myself out, but not enough to be like, no, none of this is right.
Mm-hmm.
So I had decided I had like cervical insufficiency or something. And so every time I went to the doctor, I was like, this is happening. This is a problem. And they're like, you're fine. Everything's fine.
So obnoxious.
And they did look on the ultrasound and stuff, and they're like, your cervix is fine. There's no issue. But it's like, okay, but like, why?
It's
why
not
is
just
this
in my head.
Why is
But
this
like, also,
happening?
you're probably not the first person to ever walk in to the doctor's office and say, hey, it hurts when I have sex. What's going on?
Right, but it was
Yeah.
also new, and that was the thing. So I was like, this seems to
Right.
be pregnancy specific because this
Right.
was never an issue.
Right. But you're probably not the first woman to ever walk in and say, it didn't hurt. I'm pregnant. It hurts now. What's going on? Like,
Yeah. And I mean, some of them were just like, oh, you're fine. Like, you don't need to be concerned at all. But then
but sex
some
still
of them
hurts.
were, it was the attitude of like, just have a glass of wine and relax. I mean, they weren't actually telling me to drink wine.
Right.
But that was the attitude of just like, you're just worrying.
Right.
And I'm like, come on, man. But
It's
yeah.
It's that, like, I mean, it comes up time and time again, and like, I'm a man, so like, this is not something I necessarily experienced. Although, like, when I got my vasectomy, like, I kind of had a similar experience with a doctor where I was like, something is wrong, I don't know what's wrong, and they were basically like, yeah, just take these antibiotics. And I'm like, I don't understand why I should do that. I don't have any other signs of an infection. Can you give me more information? And his response was basically, well, I can reverse it if you want. And it's like,
That doesn't answer my question.
You did basically your own research and like figured
And
out
figured
like,
out why
they would
he
have
was-
prescribed
right.
you
But
antibiotics. It's like, why didn't the doctor?
So like, it
just
happens.
tell me?
So like, not to make it a gender thing, like, it does happen to to everybody in terms of doctors being like, you don't know what you're talking about, and I know what I'm talking about. And certainly, we rely on doctors to be the knowledgeable ones, but then be the knowledgeable ones. Like, if you're walking in and saying, I never had pain with sex before, I'm pregnant, we're barely in. I mean, the baby is non-existent at this point. It's microscopic, and yet I'm having pain.
Yeah.
And like, for them to not go through and just say, okay, well, like, here are some things it could
Or,
be.
like, do a pelvic exam.
Yeah.
You know,
Right.
there was no like.
They didn't even do a pelvic exam. Oh, God, are you kidding me?
And
Like, dude, just
and
do
this is
something other than
multiple
you're
times.
fine.
Every
You were-
appointment I had the
Yeah.
entire pregnancy. Not to get too off topic because this is not even pregnancy related. With getting diagnosed with Crohn's, I went into my primary care and was like, I am having stomach pain that is reminding me of late term labor in terms of the amount of pain I'm
Oh,
having.
gosh, okay.
And they did not touch my stomach. And was like, it's probably IBS, which is just code word for anxiety.
Right.
Less than a week later, I was in the hospital with an infected ulcer that was borderline about to rupture and put me septic.
Like, at that point, like,
Damn.
they're liable. Like, at that point, it's a lawsuit.
I was so frustrated.
And I don't understand where it comes from. It's like, if you come in one time and you complain about something, like, at the very least, put your hands on the patient, right? But like, at that point, it's like, yeah, it's probably nothing. Like, we'll keep an eye on it, kind of thing, right? Like, but like, if you're going in multiple times to complain about the same thing, like, at some point, somebody should be like, here are a list of things it could be. Let's do a pelvic exam. Here's what I'm going to recommend you do. Like,
Or even if it was like, the muscles down there are gonna be tight or whatever
Right.
as things are changing, it's probably just that.
Right.
Because I didn't even think about that. I was just like, something's gonna explode and I'm gonna die.
Right,
Like,
right.
Yeah.
Yeah, I don't. I'm sorry that you went through that.
Yeah, that's
I'm getting
awful.
heated on your behalf, but it didn't even happen to me. But it's like because when Megan got pregnant, we listened to a lot of podcasts, and it was like every other episode was like somebody talking about how they went in, they got a spinal, but they could feel everything going on, and they said, I could feel it, and the doctor was like, it's just pressure, and like then women had to just go through the feeling of somebody cutting them open, and like, and this happens all of the time, you know, and it's just I don't know. Sorry, I'm my male fragility is just being taken to task on this.
So jumping a little bit ahead, Peanut ended up needed a C-section.
Yeah.
Can you talk a little bit about that?
Yeah.
How did that feel going into it? Did you feel like you were prepared?
Yeah, and we took birth classes and had learned enough about it. The only thing that was stressful was I'm a very, very visual person, and so like I can see things in my head very strongly. And my sister is an OBGYN. She I think it was at the beginning of residency, and was so excited to tell me, this is like before I got to labor and stuff, the details of a C-section.
God,
of
that's terrible.
All the things
this is not good, not great.
And
don't
all the
do
things
that.
you do, and the amount of blood and whatever. And I mean, she was excited about it. She's like, "This is so cool,"
Which is fine.
And,
Maybe
so-
after you're done being pregnant or something like that.
Yeah, and so going into it, I told Zach, I'll go back to kind of the beginning after this, like, I was like, I need you to talk my ear off, because I don't want to have time for my brain to picture things. And he did.
I feel like he's probably really good at that, too.
Of all the people, he is a good person for that. He will talk your ear off without prompting.
I love that.
It wouldn't surprise me if you had some kind of like deep conversation about something.
I literally don't even remember.
Right.
He was like, "What do you want me to talk about?" I'm like, "I don't care." But yeah, it was very normal progression. I went into labor naturally, went in, labored at the hospital,
And
got an
everything
epidural.
there was no like breach or anything like that.
No,
Okay.
no, and I was 39 plus weeks. Everything was like normal.
Yeah.
Got the epidural, and it was an amazing epidural. Like, I could feel pressure, the urge to push, and no pain. So they did like a real great job.
Nice.
And I pushed for 3 hours, and they're just like,
You
not moving.
pushed for 3 hours.
Yeah.
Wow.
yeah. And they're like,
How long did you labor for?
the entire thing was 21 hours from
Okay,
when I
which is-
started laboring to when he was born.
So for the first time, they usually say like it's like 18 to 24
Yeah,
hours.
so
right?
it
It's
was
usually pretty normal.
everything progressed at a reasonable pace, and the doctor who was there the day I went into labor, I really really liked him. He came in and he's like, "It's been 3 hours." He's like, "If you were making progress, if he was coming down at all, I would say keep going." He's
Yeah.
like, "He has not moved."
Right.
Well, we didn't know it was a boy at that point, but he's like, there's stations, so it's like -3, -2, -1, 0, I think up to +3 or something. And he was at the top, like as far up as you could be.
Oh man.
And he was like, and he tested. He's like, you're pushing effectively, and like you push, and his head comes down, and then the contraction's over, and it just fully retracts back.
Right.
Oh.
And I was like, okay. He's like, he's like, I would recommend a C-section. And I was like, I am so tired.
Right.
I'm so done. Like, I don't care what you do to me. I want to be done.
Get the baby out.
Yeah. And so, like, I was not scared. I was so done that I was just like, I don't care what you do to me.
Mm-hmm.
You just cut me open, take it out.
Yeah.
I want to be done. And it's very slow. Like, it's not like in movies and stuff. It's just like alarm bells going off and they're running into the OR. I was like, not like that at all.
Well, if it's not if it's not an emergency, because like the second time it was. I mean, technically our first one was considered. I don't know if it was considered
Not
an
an
emergency,
no,
but
neither were
they moved
emergencies.
pretty quickly
They
with that
did.
first one. With the second one, it was very clear that like, yep, you got plenty of
We
time.
had hours,
like-
which was almost worse because then I was like thinking about it
Yeah.
too much.
Yeah. Yeah, they were like, not dilly-dallying, but it was just like, here's your consent form.
Mhm.
Read it. Sign it. Like,
Yeah.
come in. And then they took me back. Zach came in eventually. I don't even remember.
Did they
at
do
this
the
point.
whole spinal and everything?
Yeah.
and-
So I already had an epidural, and so they didn't even have to do a different thing.
Oh, nice.
They just
Okay.
like ramped up the dose, and I like could not feel anything. I was like a torso and nothing else.
Yeah.
Wow. Yeah.
And I get into the OR, and I was like, oh, it's gonna be like this big scary thing. And there was like a decent amount of people in there, because there's like the doctor and the nurses, and then
Mhm.
the pediatric team, and like there's a lot of people, and Zach and the nurse taking care of me, and all these people, and they're all like having a party.
Yeah.
Like they were all so happy. I could hear people like talking about their plans, and because I think it was a Friday, I can't remember. I think it was like near the weekend.
So strange.
And like everyone's just like having a grand old time, which I think was intentional, because they want it to seem it's a birth, it's like
Yeah.
a happy thing, and it wasn't a dangerous situation, and so they're like, it's gonna be great.
Yeah.
And the doctor, who is a wonderful human being, came in. He's like, I want to play music that you want. He's like, give me your phone. We'll put on your playlists. And
That's really nice.
I love music, and so I spent all this time. I had like 5 different playlists for any possible scenario
Right.
that I could have, any feelings I might be having. Spotify was down.
Ah!
A worldwide,
Oh, no.
worldwide Spotify outage on that one day.
Sure.
I was like, of course. And so he's like, okay, what's your favorite band?
Yeah.
I will put on Pandora. I was like, Matchbox Funny. He's like, okay, that's what we're going to do. And he put on Matchbox Funny Pandora. And then it was really fast. He's like, okay, I'm gonna start. And then it was, I mean, you know this. I'm like strapped down, my arms strapped down. I'm like straight out to the side, and I can like my whole body's moving because they're yanking on my legs,
tugging.
And and I remember the nurse who was taking care of my mental state was just like, if you feel sick, tell me and I will give you something. And I was like, I feel sick. And she's like, okay, we can give you something. And so they gave me Zofran and the IV. And she's like, if you are going to throw up, tell me and I will come over and I don't want you puking on the floor. I was like, I can do that. And I remember the doctor was like, okay, it's baby time. Remember what song's playing? And it was If You're Gone by Matchbox 20. And I still, like, when I hear it, I like, brings me back there. And then they pull him out. And so we didn't know he was a boy. Right. It was all a surprise. So they pull him out, and there's like a split second of silence. And I'm like, but then he starts crying, and they're like, everything's good. Like, everything looks fine. And they held him up, and Zach, like, goes up and looks, and he's like, it's a boy, it's Peanut, because we already knew the name that we had picked out. He's like, he's purple, and then very quickly was like, that is a really scary thing to hear, probably. Right. It's like, he's perfect, he's a purple, perfect baby. And Zach went over with him, and the doctors are cleaning him up and everything, and I just like turned to look at the nurse, was like, I'm gonna puke. And I threw up for the next 2 hours.
Oh my gosh.
Which was really pleasant. And
so I'm after like, a C-section.
Yeah, and so I'm strapped down on the table still, puking off the side. And I ended up with this horrible knot in my shoulder. Sure. And thankfully I had brought my heating pad in my hospital bag, and so like in recovery puking with this like hot pad trying to get the knot out of my shoulder. But it was fine. It went away after a little while. It's like apparently I asked Sarah about it later, and she's like, so they take the uterus out of your body to like clean it or something. I don't know the exact details, but she said something about externalizing the uterus triggers vomiting. She's like, it's a very common thing that is the moment where it starts. So
I think I could have lived my whole life without knowing that.
Yeah.
They take it out?
No, I don't want to talk anymore about
not
this.
like they don't detach it, but it's like
it's
in the world.
Oh my.
Oh. Hearing about them taking it out triggers my
vomit reflex.
Yeah, and so I don't really remember getting transferred to recovery. Like, I remember puking in the OR, and I remember kind of becoming more aware in recovery. And Zach's sitting next to me holding Peanut, and he's just like looking around, cool as a cucumber, just like, this is normal. Which is, I mean, you guys know.
Zach's doing that?
No, Peanut.
Peanut, oh, okay.
And, like, you can just, it's like, that's very how he is now.
Yeah.
Just like, this is fine.
This is great.
Everything is great. No issues here.
Yeah, the whole OR thing is, it's, like, super surreal. Like, I remember when we went, I mean, I was drunk on the first one, so that might have impacted it. I remember, like,
it'd be funny for anyone who hasn't heard that episode. It's just like, great.
Yeah. For those who decided to listen to our podcast at this episode for whatever reason, you need to go back and listen to the birth story, because there's a reason for that. It's not. I'm not a drunk. Yeah, I'm sure. Okay, that makes it seem like I'm a drunk, but I promise I'm not a drunk. But yeah, I remember, like, when the baby came out, I don't know, I remember it being just, like, a very surreal experience. Like, they're like, oh, this is your baby, and I'm like, if you say so. Like, I don't know what you're talking about.
Yeah. So, I remember looking at him, and he was just puffy, right? Because I just pushed for 3 hours and surgery. So he was
covered in muck.
Like, I had 3 bags of fluid, and so he was just a very puffy baby. And both Zach and I were like, he looks just like our next door neighbor, who's an alcoholic.
Oh no!
Who is a very sweet, very puffy individual.
Yeah.
Who has the same name.
Oh man!
Peanut's real name and our neighbor were the same name.
I was gonna make the joke. Oh, your neighbor's name is Peanut. That's great.
But it was like, it just looks like that.
Yeah.
So you get out of the hospital. You now are home with this child. Which I'm sure felt super normal to you. What was postpartum like after the first one? Any sort of highlights from that?
Yeah, I mean, tired, obviously. Very, very tired. We got lucky with... both kids have been incredible sleepers. Just going to shout out. I know taking care of babies can be a little politically... right now, but
A little controversial.
the sleep information is amazing.
Taking care of babies can 100%. I mean, you on your recommendation, we started doing that, and made a
Saved
huge
us.
difference.
It's
Yeah,
amazing.
I mean, both kids slept 12 hours through the night. Peanut at 14 weeks, Jelly at 12 weeks.
That's
And have basically
It's a game
access.
changer. That's a game changer.
It's incredible.
Like, it's wild. But anyway, yeah. So very, very good sleepers. The one issue that came up was like, I was so excited to breastfeed. I was like, this is going to be great. I'm going to love it. We're going to be snuggle buddies. And I hated it from the very beginning. I was like, this is just the worst thing ever. And I remember telling Zach, like, when he was home, I'd be like, just please sit with me while I feed him. And he's like, I would love to, but, like, someone needs to make dinner. Someone needs to do the dishes. Like, I have work. And he would a lot of the time sit with me, but sometimes it's just like, if you want to eat tonight,
Right.
like, I need to go make dinner. I remember just being, like, feeling so lonely sometimes, or every time I was feeding him. But I was like, I didn't want to say that to anyone, because, like, people's response to that is going to be like, you're a terrible person.
Sure.
And I didn't want to say that to the doctor, because I'd be like, you need to be committed. And so I didn't say it to anyone. And I don't think it was later. So it was after he was weaned. I was on Instagram or something, and there was a video. Do you guys know Shauna the mom on Instagram?
Yep.
Amazing.
Shauna the mom, yeah.
And she had a video where it was, her and herself, who was supposed to be somebody else, talking about it, and one of them's, like, nurses, and then has the letdown in her face, and she's just like, oh. She's like, oh, is that melancholy feeling? And they're like, so it's just her way of explaining, like, this is a thing. She's like, is that a thing? She's like, yeah, it has a name and everything. It's like a hormone, like a kind of a weird hormone reaction. And I was like, someone should warn you about that.
Right? It's wild, because we live in an age of social media, so, like, we're getting so much more information than past generations.
Yeah, and I've read a little bit about it since then and talked to the midwife.
So explain it to our listeners.
It's called dysphoric milk ejection reflex, so it's D-MER, I think.
D-M-E-R.
Yeah, I've only seen it written. I don't know if people actually say the acronym that way. But yeah, it's just like, instead of a spike of dopamine, you get like a plummet of dopamine. And so I've read different people's experiences, and it's always like a different emotion. Like, it's a negative emotion, but like, some people are like, oh, I feel like I'm in trouble with my parents, or I feel just like really depressed, or like, for me it was like really lonely. And like, the way I tried to explain it to Zach is, it was like, I feel like there's dementors around. Like, just everything good is sucked out of the world. And it's short too, because it's just during the letdown. So it's just like, for that brief second, or couple seconds or whatever, you just get this horrible feeling, and then it goes away.
Weird.
Yeah, and I feel like it was easier to articulate once I knew it was a thing.
Yeah.
Because it happened again with Jelly. And it'd be weird before my milk regulated. I'd just be like walking around doing whatever, and then I'd just have like a spontaneous letdown and be like, oh, that's what that was. Okay.
Yeah.
Just like move on with my day.
Yeah.
It was really weird.
That's so sad.
Yeah. It's interesting because, like, I mean, there's all this hormonal stuff going on. And, like, you just say, like, oh, yeah, hormones. But, like, that doesn't mean anything, right? It's just, like, this catch-all. And, like, there are all these books, and you take your parenting classes, you, like, do these things. But, like, there isn't a lot of information around, like... It's not just hormones. Like, let's actually map out what's going on in time. And maybe it's because most people wouldn't care enough about it. I mean, I'm fascinated by the human body, so, like, that's just really interesting to me.
Yeah. I asked the midwife about it when I was pregnant with Jelly, and I was just like, I had this last time, I just realized it was a thing with a name, and she's like, oh, I've never met someone that's had that. And I was like, because on mine it was like, oh, like, maybe 5 to 10% of people have it. I was like, you probably have, but, like, I wasn't going to tell anyone.
Right.
I'm not going to be coming into the
Then
doctor
there's
acting like a crazy person.
So much of that.
Yeah.
You're too ashamed to
but
say it
like,
to people.
But once I knew it was a thing, it was easier to be like, this is chemical.
Right.
And it will pass. And it was easier to be like, and I found ways, because I still would feel that, like, really intense loneliness, but I would watch Taylor Swift videos. That person describing Taylor Swift videos. And, like, analyzing lyrics. So I was like, oh, it feels like there's someone in the room. Because Zach can't always be sitting in there with me. So it makes me feel less lonely when I have to have that, like, 3-second just, like, weird hormone burst or whatever. And then I think, since I knew what it was, as my milk regulated, it decreased, and I wasn't just, like, worrying about it all the time.
I don't know how to solve that problem because and I've talked about it on the podcast, but I had some pretty awful thoughts when we had our first, and it wasn't until I was able to say them out loud to a dear friend that I started to like heal from that. And like recognize that like, you know, just saying them out loud made those feelings less. But yeah, because like if you're not feeling good, it's hard to say that out loud. And if, you know, you're going to a doctor and you're telling them literally physical things like, this physical thing is not feeling good, and their response is, it'll be fine. Like,
or
for
worse,
sure...
even worse is like, that's interesting.
Right, like,
Don't know about
the last thing we're going to do is talk about our mental stuff. Like, no one's talking about their mental stuff. And so I don't know how to fix that, because, like, we have doulas, and, like, maybe that's partially their responsibility, but, like, once you have the baby, you're not meeting with your doula anymore. Yeah. So like,
and I feel like there's nothing anyone could have said, because if someone's like, "Oh, prepare for this, it could be bad,"
right?
I feel like my response ahead of time would have been like, "Oh, stop being such a downer."
Yes.
Like I hear that all the time. It's like, just you wait.
Right.
But like I don't know how it would have gotten through. So I remember when my sister was pregnant, as part of her baby shower gift, I like wrote a letter of like all the stuff that I would have wanted to hear at 2 weeks out or whatever, and gave it to her husband. It was like, 2 weeks in, you guys open this.
Yeah.
And it was like,
love that.
Yeah, and
it's a really good idea.
It was like, I think I started it with like, I hope everything is magical and wonderful, and you read this and you're like, what the fuck? Yeah. And if not, hopefully this helps. And it was just a lot of the stuff. It's like, you're doing great.
Yeah.
It's okay if this is terrible right now.
Yeah.
And like, you know, because I think that's a better way to do it than trying to do it ahead of time, because you really have no idea what you're in for.
Well, and also again, like the hearing it is, if you're not going through it, you're not hearing it, right? But I think it's more just like, if there could be somebody who, and I don't even know how it would work, but it's like, here are these thoughts that are coming in. I don't feel comfortable saying them out loud, but like knowing that saying them out loud might lead to some kind of answer. So like, I don't know what the answer is to that. Because...
Well, I think a lot of it is around hearing other people's stories, because even this generation, we're going to be growing up with way more information and like awareness than our parents did, and hopefully our kids are going to grow up in even more awareness.
Yeah, maybe that's
like
right.
That helps shed light on things that used to be kept in darkness and secretive, and
and just having someone else to be like, yeah, this can be pretty terrible sometimes. Things
Yeah.
can be really tiring and exhausting and
I can't
great
remember
and bad.
I can't remember if it was you or another friend that I was video chatting with right after having a baby, and I said explicitly, like, it's okay if you hate it right now.
Yeah, I think that was you. After Peanut was born. I remember being, I was pregnant with Jelly, and I had a friend who was like, I think she was a week ahead of me, and we just went out to dinner, and I was like, oh, hey, how you doing? She's like, terrible. She's like, how are you doing? I'm like, also terrible, great. And I was like, moved on, because we were both so uncomfortable. It was like the middle of summer and stuff. It's like, oh, it's good to have someone just be like, yeah, I physically hurt on every part right now.
Yeah.
It's really interesting because there's like it can also like you can get sucked into being the negative thing, so it's like trying to find that balance. But like yeah, because when you have a baby, everyone is like, oh, it's so happy, everyone's so happy, this is so great, and it's like yes, and also there are parts of it that are really really hard, and we can make space for both things. Like we can make space for the fact that like all of this is really really wonderful, and also like I haven't slept more than 2 hours at a time. I'm fighting with my partner constantly because both of us are exhausted. Each person thinks they're doing more than the other person, is resentful of the other person. I as a non-birthing partner literally am useless here because like the baby doesn't want me for any, like there's like all of this stuff wrapped up in it, and it's tough. Like that first year to 18 months is really hard, and like it's really great because you have this baby, and babies are great.
Right.
So yeah, it's
all of the things.
It's all the things, yeah. So, you know, you had mentioned like pain during pregnancy. Did you experience any like need for physical recovery after birth? Was there anything that lingered from that, or anything else that you experienced that you had to like go to anyone to see for anything?
Yeah. So I you know, they give you like 6 weeks or whatever to heal the scar and everything from the surgery, and I was still having a little bit of pain like on the right side, and I mentioned it at the 6 week appointment. He's like, 6 weeks is still like not very long, so
right.
he's like,
You just had like major
like,
abdominal surgery.
Just wait a little bit longer, see if it resolves, and if it doesn't, like give it a couple weeks, and if 4 weeks out, come back. So I was back 4 weeks later, and I was like, it's still really hurting. He's like, okay, like he like felt everything. He's like, you don't have any like really bad scar tissue, like nothing seems to be sticking, it's not opening, like there's nothing that I can tell that's wrong with the scar. He's like, but what can happen is, if there's a scar that's like kind of hard and it's rubbing on something or something starts sticking, it can cause pain. So he's like, go to a physical therapist and they can kind of work out that scar tissue and teach you how to do that. And I go, and
I know it's not to cut you off, but I know like with Megan also, like, because your ligaments and everything get like looser, right? And so like there's also quite a bit of like hip stuff that happens. Was this your hip or was this?
No, it literally felt like it was
like
just under the scar.
Oh, okay,
yeah,
gotcha.
yeah, like directly from the scar. And so I was also having like back pain and knee pain and everything hurt.
All the pain.
All the pains. And so I go and they figure out the knee pain and the back pain pretty quickly, and they're like poking around at my scar, and they're like, I don't think it's the scar or the surgery. I think it's just in the same area, and so you're assuming it's that because that makes sense.
Sure.
And so they like tried a bunch of different things and ended up, I think it was just I can't remember what it was at this point. Like some stretch with like my leg off the table, and it was just like a weird tendon in my hip. And they were able to like do a few exercises and stretches, and it went away. But I was still having like other pain, and they're like, pain in this area, especially after delivery, you really should go to pelvic floor PT. And I was like, I can do that.
And that was something you were aware of, not aware of?
I was aware of it, actually.
Okay.
And I had thought about it. So when I was pregnant, we read a book called Bringing Up Baby. It's like an American woman living in France, has kids in France. And she said in the book, like, everybody gets referred to pelvic floor therapy. It's just
in
like
France?
in France.
Oh, wow.
It's just, you had a baby, you're going to need fixing
I love
afterwards.
that.
And so I knew about it, and I had thought, like, if, because the book was really like, peeing when you sneeze or jump is fixable. Like, don't assume that that's not fixable. And I mean, I had my whole life of like all the older women in my life, like, you're never going to be able to jump again. I still pee when I sneeze, blah, blah, blah. So I was like, oh, if this comes up, it's fixable and I can go. But I didn't have any of those issues. Maybe partially because it was a C-section instead of like a vaginal delivery.
Right.
So I hadn't thought about going. And so they're like, you should really just go anyway.
Right.
And around the same time, we had set up a call with the woman that taught our birth class. Because I was like, I had a C-section. I didn't want to have a C-section, especially if we still wanted 5 kids at this point. I was like, you can't have that many C-sections. And so I really wanted to have a VBAC. So I just like had a conversation with her. I was like, this is kind of what happened. He got stuck really high. Like, what can we do differently next time? She's like, she's like, with my first delivery, she's like, the exact same thing happened. Baby got stuck really high, and it was not a big baby, and ended up in a C-section. And she's like, I went to pelvic floor therapy after, and they said 2 things. All of my pelvic floor muscles were weak, and therefore tight, trying to compensate for the fact that they were weak. And she's like, and my hips were crooked. Like, normally your pelvis is like, or
it's like
in
a
theory
bowl,
it should
right?
be straight, but it's like, it can be crooked in a way. And she's like, and that can shrink the space coming through your pelvis. So she's like, go to pelvic floor therapy. I'm like, okay, I'm hearing this from multiple directions. I should go.
Yeah.
And the woman I went to is a wonderful person, and her name is Gina, which I thought was Gina, which is amazing.
Wow.
But she's a wonderful person. And so
that's unfortunate.
Yeah. Or fortunate.
Yeah, maybe
Yeah.
she was
She was definitely the type of person that like
It's meant to
could
be.
lean into that.
Yeah.
She's very chatty. But so I went in, and it's a pelvic exam. You're naked from the waist down, and they're fully in there. And she's like going in, doing it, poking around. It's like, okay, does this hurt? Does this hurt? Does this hurt? Does this hurt? I'm like, no, it's not too bad. And then she hits on a point, and it was just like really sharp pain. I was like, oh, that's the sex pain. That specific spot, because it was like the whole time it was always one specific spot, really high up and on the left, which is weird. And she's like, yeah, that's the obturator internus.
Obviously.
Duh.
Didn't you know that?
I don't even remember if it's a muscle or a tendon. Probably a muscle. And she's like, yeah, it's just like super tight
Okay.
She's like, that can happen. It's like one of the main things supporting weight in the pregnancy.
Okay.
She's like, yeah, it's an easy fix. She's
Cool.
like, we're just gonna like massage it. I do like go back a bunch of times and stuff, but you just like massage it, and then she gave me strengthening exercises to make it stronger so it wouldn't get tight in the future.
Right.
I haven't had the issue since.
Wow.
Yeah.
And I was just like,
It's amazing.
Did you write
That's
an
what it
email to that
was.
doctor to say, hey, this was the problem?
no, I didn't. No, if we had stayed down there for the second birth, I would have switched practices.
Right.
Because enough of them were difficult that,
Sure.
yeah.
Jeez.
But it was just like a light bulb moment. Like, that's all it was?
Yeah.
What?
Do you feel like the pelvic floor therapy helped with the second one?
I think so, yeah. And
Because
so
you had a VBAC, right?
Yeah. And so I did that to treat that issue, and then we moved, and that was like a whole thing, and then I got pregnant with Jelly. And so I was like, yeah, I'm going to make sure my pelvic floor is like fully ready, make sure my hips are straight. And so I went right at the beginning of the pregnancy and was just like, because I still had all the exercises and stretches and all the things that I had gotten from the person in Pennsylvania. And so I just went and was like, I'm pregnant now. This is what I have. Can you just take a look and make sure everything seems okay? I'll keep doing this, and then I'll check in every couple months or whatever throughout the pregnancy. And so I did that, and
With a pelvic floor specialist?
Yeah. And I think it helped. So when I went into labor with Jelly, everything was progressing very similar. Throughout the labor, like the early stages of labor went almost exactly the same. And I got to pushing, and I'm pushing, and they're like, I heard the midwife say, the baby's stuck really high up behind the pubic bone, which is what the other doctor had said with Peanut. And it just hitting the pubic bone and not coming under, which is, it's just like almost verbatim what they had said about Peanut. And I turned to Zach, and I'm just like, it's the same thing. I'm going to go through a day worth of labor, and the end result is still going to be the same. And my epidural failed the second time, so I was not in a good place.
Right.
And I was like, I'm going through all of this, and it's still not going to work. And the midwife, Julia, who is a wonderful human being also, she's amazing, was just like, no, we're going to figure it out. You have nothing to worry about. We have so much time. Like, we're going to figure it out. We are going to move you. And I don't remember the details of this part. But Zach's like, yeah, she was just like, she would move your leg like a couple of inches, and then, or move like twist your leg or move it here in all these different positions. And just like, eventually they're like, yep.
Oh, that's
Baby's
awesome.
Oh,
down.
that's great.
That's
Great, yeah.
awesome.
And then after that, every 5 minutes, I was like, am I almost done? They're like, we're not going to answer that. But yeah, and then she just came out, and they're like, yeah, you just had to have a little bit of patience.
I love that. Also,
yeah.
just like the manipulation, you know, like
Yeah, and
when you're in a
that's
hospital, you're so
what
much...
didn't happen with Peanut, because I was in like this huge hospital setting there,
Yeah.
and like I think I saw the doctor like twice before he came in and said like, hey, you should do a C-section, and I couldn't. Every time I moved, the monitor would move, and he would come off the monitor, and so they're like, you have to sit in this one position. But at Gifford, I was the only person there, the only patient
That's nice.
for 3 days, and so I had a midwife,
A lot of attention.
and 2 nurses fully on me. And so the midwife was moving my knees around. One nurse was like keeping me sane because I had no pain management
Oh my
and
god.
did not plan for that. And then the other one literally had the monitor in her hand and was manually tracing around my belly
Nice.
every time she moved.
Wow.
And it was like, as soon as she went under the bone, she like locked into position.
That's
They
awesome.
just were able to strap it back on because they're like, oh, okay, she's in position now.
That's great.
And like, because I had all that help, I wasn't just stuck.
yeah.
She was just like, I mean, it was probably 2 hours where she was just moving it around my stomach, keeping her on the monitor.
Wow. That's cool.
Yeah.
So now you're in it. You've got a kid. You know, you're dealing with your recovery stuff. You decided, like, even before Peanut was born, that you were gonna be at home, right?
Yeah.
And at this point, you had moved already, correct? Or
So
not
we
right
moved
away?
when he was about 1.5 years. So
Okay.
I worked part-time until we moved. He was in daycare 2 days a week from 9 months to 1.5 years. And
Okay.
then Zach and I just kind of tag teamed to fill in the rest of the time.
Gotcha. And so since then, and we should also know, like, you have a master's degree, right? Yeah, like you have had a career as working as a scientist, and you make the decision to be stay at home, which is probably the most underappreciated job out there. What was that transition like? Was that difficult? And you are still acting as a stay-at-home mom now, so you have not gone back into any sort of formal career. So how has that been?
Good. I mean, it took a little bit of a transition to get used to like the difference in pace, because in a lab you're running around all day talking to people, doing experiments, and at home sometimes it's just like, will you please put one foot in front of the other and walk? So that the pace was a little bit hard, but I think you're saying like it's underappreciated. I think one of the things that made it easier is that because Zach helped so much when we were trying to tag team all the childcare and both of us working, he did so much of the baby care in the beginning. He was like, being home is way harder. He's like, my job, I get to sit back in silence and it's like cushy and whatever. And so like, he's just like, I could not do that.
Right.
And so he's very, very appreciative of how hard it is. And I remember like back before I started staying home, he's like, your job is childcare. Like, and if you can do the dishes, great.
Aw,
and
love that.
if you can't, that's not your job. Your job is childcare.
That's a good husband.
Yeah.
What is if you haven't? I mean, I think Zach would be that way anyways. But if you haven't done the stay-at-home thing, I mean, we with our first it was similar where Megan was at home first, and then we had to offset. So I was at home, and I remember when I wasn't at home, when you were at home first, there were definitely days where I would come home and I would have had like a really tough day or whatever, and you would be like, I need to go shower, please take the baby. And I would be like, what have you been doing all day? Like, and then I was at home with the baby for like a week, and I was like, I'm a dick.
Highly recommend all partners have that experience.
Anyone who has a kid should stay at home with their kid for about a week, and they will understand how going to a job is much easier than being a stay-at-home parent.
Yeah. Well, I think that's part of the reason I feel very strongly about there should be paternity leave, and that you should take it at the beginning, is because otherwise it's like, the mom is home, they figure out the systems and they know how to do it, and the dad tries to take over and they're like, well, how do you do it? But it's like, no, you should be there in the beginning, and then you can figure it out together, and you can see how hard those days are and how long it takes to piece together what this is going to be. Because Zach didn't, so he had 4 weeks of leave, but he didn't take it at the beginning with Peanut, because when I went back to work, he took that time so that I could transition back to work. But yeah, and at that point, of course, he's like sleeping great, has like very regular naps. He's like, this is great.
Yeah, because I set it up that way.
But like he did so much of the childcare. He's like, this is a lot.
Yeah.
And I think the biggest transition is like when you're at work, especially doing science all day, you're like problem solving all day. Like it's exciting and really, really fun. And when you're watching a kid, it's like you have to pay very close attention so they don't like choke, fall down the stairs, just like fall headfirst into something for no reason.
Right.
But it's enough focus that you can't be doing something else. You can't like be thinking about something fun or daydreaming or whatever. But you're also, it's not very exciting being like staring at them, be like, are you gonna fall on your face?
Right.
And so just like sometimes like the mental tedium I wasn't expecting, and so like just finding time to like get out and do my own thing, or have my own hobbies. So I like learn to sew, and I go to trivia, and I take a gymnastics class, and just like doing other things so that when I am with him, it's just, or both of them now, like I have a break built in.
Right.
Yeah.
But yeah, I mean it's really great. I think because Vermont has no childcare, there's a lot of programs for stay-at-home parents, because there's so many stay-at-home parents, maybe not so much by choice. So there's like every single day there's like story time and play group and open gym at the gymnastics gym and just all these things. And so I mean, I've met so many people with kids the same age, and there's always something to do. And so it's not just like I'm sitting at home playing with the same toys over and over. Like we get out and do things, and they love going to the grocery store and just like things like that.
It's funny how like going to the grocery store is like it's like
experience.
It's just like a way to get you out of the house.
Oh,
Right? It's like,
absolutely.
we're just gonna go out of the house and
That's
go
our
to the
Monday
grocery
mornings.
store.
That's like our scheduled thing we do Monday mornings. But like I remember going to the grocery store growing up, and it was always like my dad would always take us, And it was like one of my favorite things. Like I loved grocery stores. It was like really weird.
Well, as an adult, it's like my least favorite place to be.
But they like also they're kind of snack motivated, and so
Sure.
Either
Makes
animal
sense.
crackers or cheese from the deli. So
Right,
they like
there
that
you
part
go.
of it. But
I remember the cheese from the deli as a kid. That was the thing.
yeah, and the nice part of it too is like, and not that like, there's many reasons. I feel mom guilt about so many things, just in general, and. This isn't saying, like, working parents should feel guilty, because that's not how I mean it at all. But, like, I spend so much time with them that I have no guilt whatsoever about being like, I'm going to leave. I'm going to go do something for me.
Right.
And I'm not going to feel even remotely bad about it, because I spend so much time with you that you're probably sick of me.
That's great.
You have like the reverse.
Yeah.
The reverse issue of what most moms is, which is like I don't feel like I can do anything for myself because. Yeah.
Mm-hmm.
I mean, it's really like you're damned if you do, damned if you don't, right? Mm-hmm. So like
even today we sent our kids to Nana's house because we are recording this podcast, and I'm thinking like it's the weekend, it's my 2 days that I get to spend with them, and like I feel guilty. Yeah. But also this is really nice.
Yeah. Right. Yeah. It's just it's so hard. The whole thing is hard. Mm-hmm. What I think is so interesting about all of that, not that that's what this is about. Like, so. You're kind of talking about how when you were in the OR, like there are all these people in the OR, and their experience is like, here's this thing that I've done 1,000 times before, and I'm just basically living my life as like any of us would at a job. Mm-hmm. But for you, that is like your first time in an OR. It's hopefully one of one, but maybe one of 2 or 3 times that's going to happen. Like, and you're like looking around like, why is everyone just going about normally? Mm-hmm. I think it's similar with our kids. Like, for our kids that are now at Nana's house, like, this is great for them. Like, they get to go be at Nana's, and, like, they're not thinking, like, I don't get to be with my mom or my dad or whatever. They're like, this is great. This is what I get to do. And so, like, it's interesting to think about that in those different ways. Like, it's a different perspective from each person's point of view. Like, what we might feel guilty about, they might not. You know, like, even like when I put the TV on for them for an hour, I'm like, oh man, like, I'm being a good dad. Like, they've got the TV on for an hour.
I'm loving it.
And they're like, I get to watch TV for an hour. This is great. This is the best day of my life, you know? So, yeah, it's interesting. So, with that in mind, like, you know, because now they're a little bit older. Jelly turned 1 this summer. Yep. And I know Peanut is in partial daycare at least, right?
Yep, 2 days a week.
Right. So do you have a game plan? Do you have thoughts about how things are going to go? Or are you very happy where you are and just like, we're just going to kind of ride this out?
Yeah. I mean, kind of hold course for now. So Jelly will, I'm assuming, go to the same preschool that Peanut's in right now when she turns 3. So that's when she'll become eligible. And I'm assuming we'll do kind of the same, either 2 or 3 days for age 3 and 4 and then kindergarten. But yeah, I mean, the plan is to keep staying home. I mean, Zach and I are both like not very good about keeping up with just like chores and house projects and all this stuff. And so like I can just see if they're both in full-time school, taking care of the house and like feeding everybody, like very much being a full-time job.
For sure.
Yeah.
Like I'm not just going to be sitting around twiddling my thumbs.
Right.
And like, you know, we planned ahead and like we knew this was the plan. And so we like were very intentional about saving and organizing things so that I could stay home. So we have it kind of set up that we can be okay on one income. Yeah. And so I'm like, well, I would rather do all that kind of boring chores stuff during the day. And so when the kids come home, we can really hang out with them, or him and I can like do something other than dishes in the evenings, and just really to kind of prioritize that.
There's a lot of, because I work from home, and I'm very, I mean, you're speaking from a place where you recognize that like you have your, it is a nice space to be in, that it can be like that. I'm very similar in that there are days where I work 14-hour days. I mean, it's a Sunday and I've been working most of today. And then there are days where, I do a couple hours of computer work and then my day is mostly mine. But what has been nice about being able to be at home is like, I can get all the lunches done before they're home. Mm-hmm. I can prep the dinner and cook most of it before I go to pick up the girls. I can do laundry and fold laundry and empty the dishwasher, that when Megan comes home, there isn't really much for her to do except, do the nightly dishes. And it is like, it's taking care of a home and feeding a family is a full-time job. Mm-hmm. And for most of us, we're doing that in the hours or minutes between other things. And then that brings on the guilt of like, I could be hanging out with my kids, but instead they're downstairs watching TV for half an hour so I can do a load of laundry, or I'm losing out on an hour of sleep because none of that got done, or I didn't have time to work out today and my health is deteriorating because of that. And
I feel like if anything, I'll probably have more quality time and more like better good time with them once they're in school, because I can do all those things alone.
We talk about that a lot.
10 times faster to just wash the dishes by myself. And then they come home and then I can just focus on that.
Right.
So that's...
I think it's interesting, right? Because I think there are more and more people, so like, our parents, a lot of our parents, or maybe the generation before, were able to live on one income without really a tremendous amount of planning. It was one income could support a family. And, the mom might have done like a part-time thing here or there. Like I know, Megan, your mom did like part-time work in the schools and found a lot of joy in that. It brought her an immense amount of joy. But then, as things become more expensive, there are more and more families that have two people going out. And now I feel like our generation, not that we necessarily can do it, but I feel like we're beginning to recognize like our time is very limited and very valuable. And I'm less concerned about making as much money as I can, and I'm far more concerned about spending it with my family. Yeah. And so I think there are more and more people who are trying to figure this sort of thing out. Like, how do I not work 70 hours a week? Like, how do I have more time to be at home with my kids?
And when, after Peanut was born, like, we were living in Pennsylvania, knew we wanted to move back to Vermont, and just given the, like, there's not science jobs here.
Sure.
It's not. And so we knew that...
To be clear, Vermont loves science, there just aren't jobs in Vermont.
Oh, yeah. It's just like there's no science industry, there's just...
Right.
And so Zach started looking right away to try and find a remote job. And one opened up in his company, would it be a perfect fit, and was like way less stress, not technically the same amount of hours, but like, let's be real, less hours, and was a pay raise. And he just like applied for it, did the interview process while he was on leave, and like started the job.
Nice.
Back. And so now he works remote, which is nice, making Pennsylvania science industry salaries.
Sure.
Because he just like would never be able to get anything like that around here. And it's very like, as long as he gets the work done, they don't bug him about hours.
Yeah.
He works when he wants, and he's like relatively efficient, so he's able to kind of do multiple things at once.
Yeah, that's great.
And it's nice because he's home during the day. Like, he'll sometimes eat lunch with us or come out and say hi. Or one of the biggest benefits was both when there was just Peanut napping, and now that they both nap at the same time. If it's 2 hours, and so he's there, and that means I can go out and do something, go grocery shopping by myself, run errands, do something for myself,
sit outside and not have to pay attention to anybody.
Go for a walk in the woods. Like, I'm not tied to the house.
Yeah.
And that's been really nice.
So going into like some actual parenting stuff, you guys clearly had a plan about getting pregnant, about what it was going to look like, about how it was going to be 5 kids, which we've talked about how kind of it's not going to be. What are there any things that you and Zach spoke about like how you were going to parent that you sort of realized early on, like, this isn't going to work? And then are there things that you were like, we're never going to do that you have sort of brought into your parenting life?
Yeah. I feel like we followed our parenting plan pretty closely. Like, everything we planned with, like, sleep and eating and just kind of like the technical stuff, I think we followed pretty closely to our plan, and like it worked really well. And so we're doing something very similar with Jelly. I think the biggest thing that we hadn't thought as much about, because like so much of the early days is very technical, is just like the like traditions and family stuff, and like there's obviously some of that already, but since the first couple years of Peanut's life, it was like we were both working with no daycare, and so it was like one of us would watch him, and then one of us would be working, and then we'd switch, and then we just in that time like had to buy a house, had to move, had to like set up the house. I was pregnant and exhausted, and Zach was doing basically everything, and so it's like so much of parenting has just been like, you take them, I'm gonna do something, I'll take them, you do something, and hasn't been as much like together we're all gonna do something,
right?
Especially now that like Peanut especially is older and not just like a blob that needs
potato,
physical
right?
taken care of. Like we're trying to figure out how to do that when there's still so much of like, I need to do the dishes, you need to take them. Like there's still so much of that. Trying to figure out how to fit in other things. And I mean, that makes it sound like we have a big plan. We don't have a big plan. But what we're like starting to think about, it's like
that's how plans start. You got to start thinking about it to create the plan.
Yeah, I mean, Zach's not as much like this, but like if I have it on the schedule, it's going to be so much easier. So figuring out, like I had mentioned to him, wanting to do like pizza and movie night on, maybe I'd do something on Friday night, but like pick a night to do that, and like every week pick a different pizza topping, and and that way if it's like built into the schedule, we don't have to think about it, because we already think about plenty of stuff.
Sure.
And so like trying to find things to build into the schedule so that we can just like spend time together as a family, and that'll get easier as they get a little older and are interested in doing interesting things. I don't know, like I mean I tried to play Candyland with Peanut the other day, and he was like not into it. Because I mean what he wants to do, and what makes it kind of hard is like he wants to be out in the woods hiking, which is great, and that's something that we can do, not when it's 10 below, and not when Jelly can't walk outside very well yet. I mean, she's walking, but like walking in shoes in the woods is like,
you know, 1.5 feet of snow. It's like not gonna happen.
It's hard. And so like that's something we can do soon. And like, you know, I remember loving playing cards with my dad. And he taught, like, we were playing poker at like 5 years old.
Nice.
We just weren't betting. He's like, well, I'm not gonna teach you betting.
Yeah. Poker's a great game.
Right, it's great.
It's a great game.
And I mean, I love all those games, but he's just not quite there yet.
Yeah.
And so like I have so many things that I remember doing and being so excited to do in like a year. When he's like calmed down just a little bit. Like we always made homemade pasta, and I could try that, but that's a little technical. So we've baked bread and made cookies, and I'm very excited about his birthday present. I got like a visual cookbook, and there's like Velcro, and you can like make your own. I'm very excited about it.
Oh, that's cool.
Yeah, so like doing that. So that's kind of the biggest thing now, is like trying to figure out how to weave like family and parenting and that kind of stuff into it, now that like he can go pee by himself, and just like he can take care of himself to some degree. That opens up a little bit of space for other stuff.
Well, it is interesting, right? Because in the first few years, you're surviving.
It's like a checklist.
And so exactly. Like, are they fed? Are they clothed? Are they clean? Like all those things. And am I fed? Am I clothed? Am I clean?
Yeah, it's like we also had no daycare, and we were both working and moving and buying a house, and we had like a huge renovation. There's like, and when we moved in, it was like none of our heat worked.
You guys went through it.
Yeah, the house was a little bit more of a fixer-upper than we had anticipated.
Yeah.
And so it's just like, I feel like we're kind of coming out of that, where it's like, we're just living life instead of juggling all the things all at once.
Well, I think there's a point that you hopefully get to where you're not surviving, you're thriving, right? And that's where all of a sudden you can be like, oh, wait, that's right. We kind of all are just like existing in our own little bubbles. Like, how do we kind of combine our bubbles?
Yeah. I feel like we're just about to get there. And like, there's been times recently where we put the kids to bed and the house is picked up, and we're like, what do we do? what do you like to do? I don't know. What do you like?
I haven't spoken to you in like 3 years.
So for Christmas, I got him these like conversation cards. It's like specifically designed for couples. So it's like the kids go to bed and our brains are both shot, and we're like, what do you want to talk about? I don't know.
Yeah.
And so to help with that. So
that's cool.
It is also what's so interesting about that, though, right, is that like even if you want to do things, right, as you said, like they're potatoes. So like, you know, Megan and I, like there were things that Megan and I did before we had kids that we were like, we will just do these things with the kids. And like apple picking is an example. Like we have gone apple picking with our children ever since they were born. But like when Snuzz was a baby, it didn't mean anything. It wasn't like, it was just like, oh, we are doing this, and there happens to be this little gremlin coming along with us, you know? And of course, like, as they get older, it becomes more fun, but like, it really wasn't until I think, like, not this apple picking, but last year with Snuzz, where it was like, oh, like, you can grab apples, and like, we can do things, and, or like games, like, this year for the holidays, like, we bought a ton of games, because it's like, we can play games now, like, you are 5, like, we actually are able to engage in these things that make us a quote-unquote family. Right? But it's like, so you're like surviving, and then you're like, oh man, we like don't really do things together, and then you realize that like, but like even if we do things together, like you're still a potato.
Yeah. Yeah, because that's like important. We want it to feel like a family, like
Right.
we do things and have fun, and like a lot of my good memories are those kinds of things, like games and cards and all these things. Yeah, he's just like not quite there.
Mm-hmm.
And even if we did try and do it, even if he was great, Jelly's wandering around like taking every dish out.
Yeah.
Oh, yeah.
And
or wants to play the game with you and is just destroying everything.
Right.
Like that's what our
We
experience
played
is.
Trouble for the first time, which that game takes forever.
Well,
But we played it with all 4 of us.
yeah.
And Mouse would just like run away after doing the pop the bubble.
She would go
She'd
climb
just, like,
something.
Run away, and we're like, okay.
Yeah.
And then we'd be like, it's your turn. And she'd be like, I'm coming. And it would be like 3 minutes later.
I think it took us like 3 days to finish
a
the
game.
game.
Yeah. But I also think that like, and again, this is a perspective thing. So like, I am very much like traditions are very important to me, and part of that is probably because I'm Jewish, like tradition. But like, so like there's that. But like also like I grew up in a family where, like my immediate family, I mean I'm sure we did have traditions, but we weren't. It wasn't great. Things weren't great. So like for me it was like, I want my children to grow up in a place where like they can think back and be like, we did this and we did that. And what I think is so fascinating is that like we have this perspective, but like the things that they're going to remember and that are going to make them think of us as a family are not the same things that I'm going to think of. Like for me, it's like, oh, every Sunday we have pancakes or waffles, and like that might be valuable to them, but like for Snuz, it might be like, yeah, my dad would just like hug me for like 1 to 2 minutes randomly, and like those were moments where I felt really, really good. Like it's like.
You don't know what the moments are going to be.
Yeah, like
memories.
We spend so much time trying to create these environments because it feels good to us, and like we want to believe that like this is going to have value, and it does. And also, we have no idea what's going to resonate with them. Mm-hmm. We have no idea what they're going to think back. Like you think back on these moments. I know, Megan, you've talked a lot about like having cereal with your dad in the morning because you would be the only 2 people awake. And for him, those were probably meaningful moments. But if you were to ask him, like, what were the things that you wanted? Like, he might not point to that as being, like, the initial thing. But, like, that was really meaningful to you.
Yeah.
And I think that's kind of the beauty of parents. Like, we're just, like, throwing things. Like, we're throwing Jell-O at the wall to see what sticks. Mm-hmm. And when something sticks, we're like, great, that's the thing. And then, like, our kids will be 25, and they'll start talking about something, and it'll be like, what are you...
I don't even remember
I don't remember that happening at all. Yeah, so... I don't know. It's all kind of. It's just like it's all just a mess. Like it's all just a beautiful, beautiful mess. Yeah. So we're kind of at the end of the podcast now, and we had an original sort of last question thing, but we're sort of changing it. So the last question I'd like to ask, and this will be our last question for all of our guests moving forward, is basically like, we're working really hard to try and ingrain certain things in our kids' lives and their brains. And as we were just talking about, we have no idea what's actually going to stick. But if you could snap your finger and like know that one specific thing, whether it be like a value or a skill or whatever, like one specific thing that like when your kids are adults and you're like, yep, I did my job. What would that one thing be?
Yeah, I mean, I think there's a lot of things that I could talk about, like, I want them to be kind and, be the kid that goes and, like, sits with the kid that's by themselves and all that. But I think the thing that really comes to mind is the first thing. It's, like, a trait I really see in Zach, and it's just, like, this belief of good in the world. And I feel like that comes up in like, different ways. But I'm, like, very much the worrier of just everything. So I'll be like, this is going to happen, and this is going to happen, and Zach's just like, everything's gonna be fine. And sometimes I'm like, but you don't know that. But he's just like,
bitch, please, that's not the case.
He's like, genuinely, it's just like, everything's gonna be fine. Yeah. You don't need to worry because the world is good, and it will work out in the end.
Yeah.
And he's a lot better about that than I am. But like instilling that in the kids, like, things are hard, things may be difficult, but the world is good, and it will get there even if there's struggles in the meantime. And then just also like, along the same vein, just like seeing the good in people, like, yes, this person is frustrating. Yes, they're being mean. Yes, bad things happen. But like, people deep down are good. Even if they're really pissing you off all the time and doing something you don't agree with. But like, if you really get down to the depths of it, there's a reason that is coming out. and that they are good underneath. Like, I think that's a big one. And it's also, like,
You can only
how
have
much
one.
excitement there is in the world. Like, I mean, you guys know Zach. He could talk about, he's more excited. I say this all the time to him. I'm like, you are more excited about, like, picking out a vacuum cleaner than I am about literally anything in my life. Like,
Zach has a childlike exuberance for life.
Exactly.
that is
Yeah.
incredibly, it's very, like, it's a very enviable trait that he has.
Right,
yeah.
exactly. And I love things. I'm super excited about lots and lots of things, and he'll just be like, just so excited about something so mundane.
Yeah.
And Peanut is the same way. It's like, I look back at pictures of him as a baby and a toddler and stuff, and, like, he was the only kid I had at that point. I wasn't around a lot of kids.
Mhm.
And so I was like, oh, like, all kids are like this. And you
Yeah.
go back, and every single picture, it's almost like he's bug-eyed, because he's just like, this rattle is the coolest thing I've ever seen. Ah! And it's funny now that we have Jelly, and she's not like, I mean, she's not excited about things, but very much not like that at all.
Yeah.
And I look at pictures of him, and he's just like bug-eyed staring at something, but it's every single picture
Right.
of him ever. It's just like, he's looking at something, and it's just like the most magnificent, amazing thing that has ever existed, and it's like a ball.
So
Yeah.
funny.
And so, like, kind of instilling that just, like, wonder in the world and, like, the
Aw.
excitement about things. And
That's a great answer.
I love that.
Yeah, I love that. I think most couples are made up of somebody who is like, everything is fine,
like
and
the
somebody
Optimist and the pessimist.
and somebody who is like, nothing is fine. And I think that the relationships that work the best are when each person recognizes that, like, I'm too far over here and you're too far over there, but together we're right in the middle.
Yeah.
You know, like, because, like, not everything is always going to be fine, but also most things are probably going to be fine.
yeah. And Zach's gotten better about, like, I'll be like, hey, we are going to drive 9 hours with a 4-month-old. Please pack ahead of time.
Yeah.
And then he does not do that. And I'm like, we need to be leaving now. And he takes a blanket, lays it on the bed, throws his crap in the middle of it, wraps it up like a sack, and throws it in the trunk.
Stop it.
And so he's gotten better about being like, maybe I shouldn't just be like, this is fine, and think ahead and back.
Well, I think that, like, and I don't know how to walk this line with kids, because I would agree with your sentiment of, like, I would also like my kids to, like, generally have a sense of, like, inner peace and calm, that, like, things will be okay. But what I don't want them to do is I don't want them to have what you're talking about, which is, like, everything will be okay, so I'm going to do zero planning at all, because I'm going to trust that things will happen the way that they will happen. Because it needs both. Like, I am very much, and I think you're probably similar, I'm an over planner. And of course you cannot plan for every single thing. You have to have flexibility and recognize that, like, just because you plan for it to go this way doesn't mean it's going to go this way. And you actually have zero control over everything. But if I don't do any planning at all for, like, the small things, like, we're going to drive for 9 hours, we probably should have a few things in the car that will keep the kids entertained. Like, I can do that. Like, I can do that as a bare minimum. And so I think, like, it's like, everything is going to be okay is this, like, big idea. And, like, I'm going to maintain that.
Yeah.
And I'm going to, like, impact the things that I can impact with the plans that I can
Yeah.
make.
Yeah, this is also off topic, but I mean, we've been together almost 14 years at this point, and Zach runs 5 minutes behind constantly. Like, it is the default, and I am very punctual. My parents are both very punctual. It's, like, very much like a value that I have, that I'm on time to things or early. And so it's just, like, it drives me up a wall. And I'm just like, just start 5 minutes earlier. Just start. And I've said, like, you need to plan in time. Like, what if you hit a stoplight and you need to wait an extra couple minutes?
Right.
Like, you need to build that into your plan to get somewhere on time. And just within the last year, he came to me and he's like, so I was always wondering why, if I walked on the treadmill for half an hour, more than half an hour had passed by the time I come back to take the kids or whatever. He's like, so I timed it. He's like, did you know putting on your shoes takes time?
This is, like, so, like, what you're describing is Zach. Like, you just described Zach in a sentence.
Like, I have been telling you that for 14 years.
But I can just see his face. I can see his face, like, with the childlike exuberance. Like, did you know? I timed it. Did you know?
You don't just teleport from one
Can you
space.
believe this? I'm just like,
I adore him. I think he's such a wonderful human.
She's like, yeah, I'm aware of love that.
Oh, man.
He's like,
so funny.
and then you have to take your shoes off after. That also takes a couple minutes.
Yeah. Yep. Yeah, that's true. It does.
Oh my gosh.
Well, this has been a pleasure. It's always great spending time with you, but it's great, especially great spending time with you in this capacity.
Yeah.
I appreciate your insight, and I think you've got a lot of stuff in your story that I think is not necessarily things that are like I've never heard of the D-MER,
D-MER.
D-MER, and of course pelvic floor therapy is something I've heard in passing, but is not something I think is widely well known. So thank you for coming and sharing your story. Thank you for being open and vulnerable.
Thanks for having me.
And we'll see you around.
Please like, follow, subscribe. You can email us at ponderingparenthoodpodcast@gmail.com or follow us on Instagram at ponderingparenthoodpod.
Just so everyone knows, Megan regularly, I think weekly now, is putting out social media stuff.
I'm just
we're just
posting away.
And I think Megan refuses to admit it, but I don't know. I think our bonus episodes are going to pick up here a bit. Megan keeps coming up with ideas for bonus episodes.
I'm not committing to anything.
Megan loves this podcast more than I ever thought she would.
I do love the podcast.
She loves the podcast.
But yeah, send us any content you want for bonus episodes.
Bonus.
Okay.
Bye.
Bye.